Hello, this is Austin Tong. I'm speaking with Good News Broadcast, Good News Planet, and I am here talking to an executive director of the National Association of School Nurses, Donna Mazyck.
Yes, perfect.
So, what is happening with school, like work, or like what should the people do to stay healthy?
Thank you for that question, Austin. It's the holiday season and a time when families and friends get together and celebrate. And
Yes.
given the time of year and the holiday gatherings,
Right.
you and your loved ones could be in close contact with other people and become exposed to vaccine-preventable diseases or spread them. So this is a great time for people to check in with their healthcare provider, their school nurse, to make sure that they and their family are up to date with their vaccinations, and that'll help them be safe and stay healthy this end of the year and beginning in the new year.
So, now, this it says here, stay healthy in 2012, but the 15th of December, is that this year or is that next year?
What we're doing is taking advantage of the holiday break.
Okay.
To check with our doctors and making sure that you and your family, your listeners' families, are up to date on their vaccinations. So we want to start that now during this holiday season, and that way, by getting, for example, vaccination to protect against whooping cough, the Tdap booster vaccine would be very important for adults and teenagers to get protection. Against tetanus, diphtheria, and pertussis, and also the flu vaccine. The National Association of School Nurses is working together with GlaxoSmithKline to encourage families to go ahead and make those appointments with their healthcare providers so they can be sure that their vaccinations are up to date.
So, the flu has, the flu season hasn't really ended, has it?
No, you're correct. The flu season has not ended. The flu season has not even peaked yet. It'll peak somewhere in January and February and can last through April. So the Centers for Disease Control and Prevention, the CDC, recommends that everyone, most everyone, 6 months of age and older, get an annual flu vaccine. And there's still time to do that. School nurses can give families the referrals to where they could go in the community, and your healthcare provider can also help you to access those vaccines.
Sweet. So, the flu is, and then the coughing, and then, is there anything more important than the flu and coughing and stuff?
Well, some of the symptoms of the flu are coughing and just feeling bad, fevers, and it's important to do 3 things to help protect against the flu. The first and most important is to get that flu vaccine, and then covering coughs and sneezes, and also washing your hands frequently. All those are very important, but it's important to get that flu vaccine. It's important to get the booster vaccines that are necessary to help adults be healthy and safe, as well as children and teenagers.
So it's I have my grandma. Should she be getting a flu vaccine or something like that?
Well, it would be very important for your grandma to check with her doctor to see which vaccine she needs to have, but I can tell you that according to the CDC, only 6.6% of individuals 19 to 64 years old have received a Tdap vaccine since it became available for adults. So she will want to check and make sure that she's protected against tetanus, diphtheria, and pertussis, as well as the flu.
Okay.
Have you had your flu vaccine, Austin?
I don't think so.
You may want to check with your doctor.
Okay.
To be sure.
Well, have you?
Yes, sir, I did.
Okay, excellent.
Did that in October.
Sweet.
Yeah.
Well, I have one last question, and that is, what is good news for you yourself?
The good news is that I am healthy. I'm up to date with my vaccines, and I'm
Amen.
encouraging everyone out there to speak to the school nurse or their healthcare provider to make sure they, too, can have the good news of being up to date with their vaccinations. We want everyone healthy and safe. For more information, people can go to NASN.org.
Excellent. Well, thank you, and have a nice day.
Thank you,
and
Austin.